metal cylinders with tiny blades that scraped your skin to suck BLOOD. A device that slowly tightened around tumors, and a practice where doctors blew tobacco smoke into people's rectums to revive them. These are some of the most disturbing medical devices from history. Back in the 1800s, doctors were obsessed with bloodletting. They believed having so much of it in your body could cause illness, so letting it out was considered medicine. They used to use leeches to suck it out, but sometimes live leeches were hard to come by. So someone said, hey, why not make a machine that does the same thing? So the artificial leech was created, invented by French surgeon Baron Charles Louis Hardeloup in the 1840s. This thing was basically a small metal cylinder with a suction mechanism and little rotating blades that would pierce your skin and pull the blood out, mimicking a real leech. People used it on sensitive areas, like around the eyes or temples. Doctors thought that this was a huge improvement, because it could be reused and controlled more easily than live leeches, of course. But it was really just messy, painful, and often caused infections. Some patients reportedly ended up with more damage from the artificial leech than they ever would have from a natural one. Not to mention that bloodletting was completely useless in the first place. The Ecraseur was a wide loop or chain that slowly tightened around a skin growth until the blood supply was cut off and the tissue died. Invented in the 19th century, it was mostly used by surgeons to remove growths without the bleeding that traditional cutting would cause. Now, that sounds like a good thing, but the way it worked was pretty terrifying. The surgeon would wrap the loop around the base of the growth, then crank it slowly tighter and tighter. The patient could feel everything as the tissue was strangled off. This would usually take several minutes. No anesthesia in the early days either, so this would have been excruciating. Tumors, hemorrhoids, polyps, even parts of the tongue were sometimes removed with this device. Next on the list we have the tobacco smoke enema. Yeah, doctors in the 17 and 1800s actually used tobacco smoke enemas to try and revive drowning victims or treat all sorts of other illnesses. The idea was that tobacco smoke blown into the rear end would stimulate breathing and revive the patient. Why, though? Well, the belief back then was that nicotine could shock your system back to life. The device was a contraption with a bellows, a tube, and a nozzle that delivered smoke directly inside the body. So, how did this all work out? It was usually pretty disastrous. Patients ended up with burns, nausea, and sometimes more severe complications. Doctors genuinely thought it worked for drowning victims because there were cases where patients survived after being treated, but probably had nothing to do with the smoke shooting up their butts. I mean, imagine someone puffing smoke into your rectum while you're unconscious. Actually, to be fair, I think I'd rather be unconscious for that. Trepanation is one of the oldest medical practices in history, and the tools used are enough to make anyone squirm. Basically, this is drilling a hole into someone's skull. For centuries, people thought this could treat everything from head injuries to medical illnesses. The tools were pretty crude, as you can imagine. A sharp circular saw to bore into bone. Surgeons had to be extremely precise because one wrong move and you'd slice into the brain. Usually they didn't have effective anesthesia though, so patients were wide awake for this. As you can imagine, this led to a lot of infections and a lot of people died. As I said before, this was usually done to treat head injuries. They thought it would release pressure in the skull, but there were also other reasons. Some thought it released evil spirits. Horrifyingly, archaeologists have actually found skulls with multiple trepanation holes, and these tools, I mean, yikes. Imagine your doctor pulling one of these things out and telling you you're gonna drill into your head with it while you're awake. Really makes you wonder how anyone survived this. Clearly they did though. The Liston was designed for one thing, amputations. Back in the 19th century, before anesthesia was widely being used, surgeons needed to work fast to save lives and reduce pain. Enter Robert Liston, a Scottish surgeon famous for performing amputations in under a minute, sometimes even faster. His blade was long, razor sharp, and built for speed. Patients were fully conscious, strapped down, while Liston just swung the blade with terrifying precision. Blood loss was a huge problem, so the blade had to be sharp enough to cut cleanly through flesh and bone. Not too surprising that a lot of patients went into shock or just died from infection afterward. Surgeons considered the Liston blade a major advance though, because it reduced the time someone suffered during an amputation, but watching it in action or experiencing it, it would have been horrifying. Hospitals at the time were pretty grim places. You probably don't need me to tell you that. And tools like this just made them feel like torment chambers that Cenobites from Hellraiser would hang out at. Back in the 1500s, wounds from firearms were basically a death sentence. Surgeons came up with some creative ways to try and save people. One of the most terrifying was the bullet extractor. It was a metal tool shaped like a claw or spoon that you just shoved into the wound to fish it out. These things were long, rigid. Sometimes they had serrated edges to grab the bullet, which meant it would rip through the body on the way out. Infection rates were crazy high because antiseptics didn't exist yet, and sometimes removing the thing actually caused more damage than it would have just leaving it in there. Surgeons claimed it was life-saving, and in some cases it might have been, but a lot of patients ended up with mangled limbs at best, and at worst, they just died. The device looked kind of like a giant needle, twisted metal with like a sharp claw-looking thing at the end, meant to dig into the body. In the 19th century, doctors tried all sorts of ways to fix facial deformities, but few were as cruel as the nasal correction device. Now, this thing actually looks kinda elegant on the outside, but the way it worked was anything but. Basically, it was a metal frame with screws, and those screws went right into the nose, applying pressure to slowly reshape the cartilage over time. Patients would often scream in pain as doctors turned the screws, trying to straighten crooked noses or correct injuries. There was no anesthesia, and even with it, the risk of infection or permanent scarring was high. People went through pure agony for hours a day to fit society's idea of a normal face. Not too surprising, really. Some patients ended up with their noses permanently deformed or badly scarred, so they looked just way worse than they ever did before, while using a device that was supposed to make them look more aesthetic. Yeah, people still do this kind of thing today. The Bistoury Cache was a French invention designed for one nightmare-inducing purpose: removing bladder stones. It's basically a hidden blade inside a rod. The doctor would insert the device into the body, then extend the hidden blade to cut and extract the stone. Yeah, I squirmed in my seat when I first read about this. Again, forget about anesthesia as well. Even with a very skilled surgeon, the risk of infection and permanent damage was pretty high. One slip could cause catastrophic injury. Some versions had mechanisms to control the depth of the cut, but that hardly made the experience any less horrifying. The Speculum Oculi. It sounds kind of fancy. Sounds a lot nicer than it actually was. This was a metal device used to pry open your eyes for surgery or examination. Now, on paper, that's pretty practical. I mean, you need to hold the eye open to operate, but I mean, metal prongs pressing on your eyelids, holding them wide open while doctors poke around with instruments. I think I'd rather just, handle whatever vision problems I was having going through this. Now, obviously, tools like this are still used for eye surgery today, but back in the 18th and 19th centuries, patients were awake for this. This would have been done while studying eye diseases or performing early cataract surgery, which were cutting-edge treatments at the time, but the instruments look straight out of Saw. The idea of just sitting there wide-eyed with a cold metal device, keeping your eyelids pinned back, yeah, it just makes you cringe. Before anesthesia was common, amputations were really a race against time. Surgeons used amputation saws, large curved blades designed to remove limbs as quickly as humanly possible. Speed was everything, because the patient was usually fully conscious, strapped down, and just screaming louder than they would have in their entire lives. The saws were intimidating, even by saw standards. Long, heavy, razor sharp, built to slice right through bone. Surgeons would often make multiple passes, though, to finish the job in under a minute, and even then, BLOOD loss and shock ended a lot of patients' lives. Infection was also a massive problem, because sterile techniques weren't really standard yet, so surviving the surgery didn't even guarantee you'd survive long enough. Well, with all that said, I've been your host, James, and I'll catch you, yes, you specifically, in the next video.